I remember once when I was working on the floor, I was doing the night shift and it was later in the morning, getting close to do the morning rounds around 5 o'clock. And we were all laughing, the nurses were laughing at the desk and that. Then we started to do our morning rounds and I walked into this room here and there was a patient and he was wide awake. And he was in for side effects from the chemo and that, so we had him there and he was going to be going home shortly. But I asked him how his night was going and he was saying he had a bit of a rough night, and I apologized. I said, oh my, maybe we woke you up. And he said, no, I did wake up to the laughter. And he said that was the best ever. It was so nice to hear the laughter, that nurses need to laugh more. And from that I took, it is okay to laugh, because it is hard working with patients and they're going through rough times, and their families are going through rough times. But we get to go home after each shift. And sometimes you feel guilty going home and laughing at home and enjoying our life. And it gave me the approval that it's okay to laugh. They kind of keep me grounded, okay? When I'm speaking to them and they're speaking back, like we're one-on-one with one another, and they just keep me grounded, and they're able to open up more, and that's the most satisfaction I get, when at the end of the day you know you've helped somebody.
Being an oncology nurse for all of these years, I mean, it's really difficult to kind of define it by one patient. Just a little boy who was 3 years old, and his favorite movie in the whole entire world was The Lion King. We must have watched that when he was in our unit probably 3 times a day for about the month and a half, 2 months before he went home. Unfortunately, he didn't make it, but to remember his little body on the bed, just dancing when Hakuna Matata came on, just the joy he had and the smile that he presented in himself, that no matter how bad the situation became, he just had this joy for life. For me to do this, it truly is one of those things. I can't say that I've had one patient experience, but it's been multiple, and my patients always touch me in a different way and they give me different experiences, whether it be someone who's in their 90s to someone who's 3. Those patients always just give you a different outlook on life and what spirit means and what is to rise to the challenge of having to go through a cancer diagnosis.
I was first year nursing right out of school, and I worked on an inpatient oncology unit out west. And I had an assignment, and I can remember this one patient that I had. I was doing his care for him, and he never had anybody ever come in and visit him. He was always quite alone. He never had people come in. He didn't have any visitors. He didn't have any friends. He didn't have any family. And he had said to me at one point, he wasn't the nicest man. And this is why he was alone at the end. I was doing his bed bath and I was cleaning the palm of his foot. And as I wiped it and I looked at his foot, because I was doing foot care at the same time, I saw that he had a numbered tattoo on the palm of his foot. And I said to him, oh, what's this number? Because I'm thinking in my head, he's not old enough to have been in Jewish concentration camps. Like, where is this number coming from? And he said to me, that's my POW tag. And I was like, your POW? And he goes, yes, I was a prisoner of war in the Korean War. And he says, that's why I'm not afraid to die, because I've already been to hell. Probably about a week later, I was down in another room with another patient assignment, and one of the nurses comes up to me and she says, oh, Karen, Mr. So-and-so is actively dying, so you might want to come and sit with him. So I went into his room and I sat beside him and I just held his hand and I said to him, it's okay, you've been to hell already. It's okay to go to heaven now. And within seconds, he died. We We don't live people's lives. I don't walk in their footsteps. I don't know what he has lived through. So my job as his nurse is to make every day that he has left as peaceful and as non-judgmental and free, and to be the most caring person that I can be for him. And I have taken that lesson and I've translated it to every patient that I have come across.
Think back to a family that I took care of, or a patient that I took care of in my first year as a nurse, and wonderful man. The family was wonderful. I got to know them quite well over the course of a couple days, and then I remember he deteriorated pretty quickly at one point, much to the surprise of the family. And you know, the emotional and the physical reaction that the family had. You know, there were times that I was taking care of the family almost more than the patient. Their needs outweighed the patient's at that time. Weeks later, I received some letters from the family, and it really spoke to me that in our job, it's not just about the patient. The family is just such a huge aspect when it comes to cancer. Our nursing is about the family as well. So I've always tried to incorporate that as best I can into my practice, getting to know the family, knowing them all by name, and incorporating them as much as I can in that patient's care. When dealing with patients who are battling cancer, we have many life-changing moments, private moments that we're invited into as a result. And it's definitely as an honor to be able to be part of those moments and to help someone out in such a crucial time in their life. And I have a lot of respect and honor to be there, to be able to help out.
I had a patient a few months ago. She was not too much older than me. She was a mom of 2 and a wife. She had cancer. She ended up passing away. But I just remember her 2 little kids coming in after school every day, and she would somehow find the strength to walk up and down the halls with them, even when she was very sick, swollen, in pain. And seeing her like that just made me realize even more that everybody has a different role in life, and it's important to remember that, yes, she's a cancer patient, but she was a mom, and she was a wife to somebody, and a daughter to her parents, a sister. I need to treat everybody the way that I want my family to be treated one day if they're ever sick.